Fix sagging neck. Now the surgeon's silence is your secret. My dear friends in America, please come closer. I want to share some honest, practical wisdom about an area of the body that is consistently forgotten, yet which always whispers the truth about our age: the neck. Have you ever stood before your mirror, perhaps after carefully applying your beautiful facial serum, and thought to yourself, why does my face still look reasonably youthful? But my neck, this one area, seems to tell a completely different, much older story, instantly adding years to my appearance. It is a question I have heard countless times in my clinic. It is an observation that brings many good, well-caring people to me. And I want you to know, with absolute certainty, that you are not alone in noticing this profound difference. The truth, and I will tell you this directly, like an old friend sharing a vital, life-changing secret, is this: the skin and structure of your neck can, and often does, age significantly faster than your face. For many, the neck becomes the ultimate, unavoidable giveaway of one's true age. A beautiful face is a wonderful canvas, but a neglected neck will inevitably whisper the truth behind the illusion. We are not here to talk about temporary tricks or marketing fluff. As a doctor who has dedicated my entire life to this specialized art and science, I want us to go straight to the heart of the matter. We must understand, fundamentally, why this aging disparity occurs. And then, most importantly, I will outline a comprehensive, straightforward, and truly actionable plan for both prevention and lasting correction. Remember this simple, foundational principle. Achieving a timeless neck demands a holistic and combined approach. We must tackle two separate, but equally important, missions. First, the skin surface and texture, and second, the deep structural laxity and shape. Let's begin by looking at the anatomical facts. When we examine the skin below the jawline, we are truly looking at an area that is structurally and chemically different from the rest of your face. Understanding these differences is the first crucial step in protecting it. The first critical fact: the skin is significantly thinner. The skin on your neck is structurally delicate, often 40% or more thinner than the skin on your cheeks or forehead. Because it is so delicate, it has less protective collagen padding from the start. This means it is much more sensitive to irritation, and it visibly succumbs to collagen and elastin loss much faster. The second structural fact: a deficiency in natural oil glands. Unlike the face, the neck skin has significantly fewer sebaceous oil glands. Since the neck is lacking this robust, built-in shield, the skin dries out and loses its essential flexibility and elasticity much faster than facial skin does. This chronic dryness, combined with the thinness, is the perfect recipe for that common fine tissue paper look we call crepey skin. The third factor we must consider: repetitive motion and tech neck. Think of how often you move your neck every day. This constant, repetitive folding motion acts like an accordion, deeply engraving horizontal lines into the delicate, thin skin. And of course, the modern phenomenon of tech neck, where we constantly stare down at devices, places immense, sustained folding pressure, accelerating the formation and deepening of these creases. Finally, the most challenging part of the neck's aging profile: the structural failure of the platysma. The biggest issue comes from the muscle layer, the platysma muscle. This thin sheet of muscle is fundamentally anchored and held up by the supportive, deeper tissues of your face. As the fascia tissues of your face begin to elongate and slacken, the neck is no longer being supported from above. The platysma muscle begins to droop and separate, and that is when you start to see the prominent, deep signs of aging: the two vertical platysmal bands and the profound central wattle. This is not just loose skin, this is a deep, muscular, structural failure. Now that we understand the vulnerability of the neck, let's shift our focus to the biggest mistake I see and the foundational steps that are absolutely non-negotiable for anyone serious about prevention. The single biggest error people make is taking wonderful, meticulous care of their facial skin, but then they completely ignore the neck and décolleté. They treat the jawline like an imaginary fence. This makes no sense. The face, neck, and upper chest are one unified visual field. They are all exposed to the same environmental stresses together. The daily must-do sun protection. If you only implement one piece of advice from this entire professional talk, let it be this daily. Year-round sun protection is absolutely non-negotiable. Sun exposure is the #1 driver of aging. You must apply a broad-spectrum sunscreen of SPF 30 or higher to your face and extend it all the way down to your collarbone. This protection is the absolute most important foundational step. And now, a vital safety alert. Most high-strength facial skincare products are not safe for the neck. Because the neck skin is so fundamentally thin and sensitive, the powerful active ingredients that are vital for correcting the face, like high-concentration retinoids and potent vitamin C, will often cause a tremendous amount of irritation, redness, and inflammation on the neck. Anything that causes irritation actively breaks down collagen. The solution. When you plan your routine, you must select products that are designed specifically to be safe and tolerable for this sensitive, thin area. Look for formulations that are explicitly meant for the eyes, face, and neck, using gentle actives in a concentration the delicate neck can actually withstand without irritation. Remember, consistency is everything. Change in the skin is slow. It does not happen overnight. You cannot try to rush the process on the neck, as the skin simply cannot tolerate the aggressive treatment that facial skin might. So, once your daily routine sunscreen and safe skincare is consistently locked in, perhaps you require a faster, more noticeable boost to improve the surface issues, the crepiness, the fine lines, and the discoloration. We must turn to professional, non-surgical options focused purely on stimulating deep, healthy collagen and improving skin texture. The first powerful tool is standard microneedling. This is a fantastic workhorse treatment, one of the safest and least expensive ways to mechanically stimulate collagen production. However, to see meaningful, sustained improvement, you should undergo standard microneedling at least 4 to 5 times a year. The next level is radiofrequency microneedling. RF adds a controlled layer of heat energy deep into the tissue, which accelerates collagen stimulation. But please, I urge you to use extreme caution. Because the neck skin is so thin, any RF treatment must be done at a very, very shallow setting. I advise a maximum depth of 1 millimeter or less. Devices that penetrate too deep are a big no-no for the neck. Always verify the precise depth setting your provider is using. Finally, we utilize energy-based treatments like lasers and light. Treatments like IPL or BBL are perfect for reducing the common reddish-brown discoloration and sun damage that often appears. Fractional lasers can improve the overall texture, fine lines, and crepiness by stimulating deep remodeling. These procedures are specifically geared toward correcting the surface appearance, color, and texture. Now, let's shift our focus to the most crucial part of this entire discussion, addressing the deep laxity and the structural change in shape, the profound sagging, and the waddle. This is where people waste the most time and money based on false hope. Here is the sharp, honest truth from a doctor who deals with structure every day when the deep structure begins to sag profoundly. There is no skincare product, no device, and no injection of any material that can fundamentally and lastingly fix that structural sagging. It is physically impossible. Sagging is caused by the mechanical failure of the underlying platysma muscle and its anchors. A topical cream cannot lift a muscle. A laser cannot shorten an elongated ligament. You must internalize this truth so that you do not keep pounding dollars and time into non-surgical treatments that are simply guaranteed to disappoint you when the problem is structural. This is why surgery becomes the only option. If what you fundamentally want to address is the contour, the shape, the profile, and the deep laxity of the neck, you're going to need surgery. The goal of a comprehensive surgical procedure is to physically restore that platysma muscle and the underlying tissues back up into their youthful, well-supported position. This physical manipulation is the only way to create a sharp, defined jawline and eliminate that visible waddle. When done correctly, your neck goes back to where it used to be. We must conclude with the necessity of the combined approach and setting absolutely correct expectations. If you undergo a surgical lift, you are fixing the shape, the contour, and the lift. But if you have spent years neglecting skin quality, your neck will have a great shape, but the skin might still be crepey, discolored, and lined. It is vital to understand that these are two separate problems, requiring separate solutions. The surgeon addresses the laxity and contour. You and your non-surgical treatments address the skin texture and color. For instance, if you get a neck lift and still see brownish discoloration, that is a skin texture issue, not a failure of the surgeon to pull the skin tight enough. Knowing which tool is used for which problem ensures you will have a deep sense of satisfaction. My friends, the number one regret I hear from patients every single day is not that they had surgery, but this simple confession: "Doctor, I wish I had started taking care of my neck earlier." If you are hearing this detailed, scientific, and honest advice now, at any stage in life, you are lucky enough to be armed with the crucial wisdom you need. There is no "it's too late" and no reason to feel that you shouldn't bother. Start today. Start by making sure you are applying sun protection religiously and using a safe, effective skincare routine that extends all the way down onto your chest. Prevention and consistency are the most important, empowering parts of this process. When the time eventually comes, and you realize that deep sagging requires surgery to achieve the shape you desire, you will know the truth, and you will not waste valuable time and money on treatments that ultimately disappoint you. Have faith in the logic, have faith in the science, and have faith in the fact that consistency, patience, and clear expectations are the ultimate keys to a beautiful, lasting result. You now have the wisdom you need to treat your neck with the profound respect it deserves.